So today in our webinar, we're going to talk about 6 practical steps to building a resilient healthcare organization. This webinar is hosted by the American Accreditation Association, and it's going to be presented by Dimajad and Dr. Rahina Khan. So let me move to the next slide. Yes, so who are we? Who is AAA? AAA is the American Accreditation Association. We are recognized internationally by the US government in order to provide accreditation worldwide. AAA is located in Virginia State, and our international operation office is in London. So our strategic objectives are so clear because AAA is committed to provide international accreditation, and we promote the acceptance of the accredited results and certificates. So as we continue to strengthen our operation teams, we develop the capacity and capability to exceed the expectations of our customers and stakeholders. So what are our services? We run through 6 departments, which are the healthcare, training, and education providing accreditation, school accreditation, inspection bodies accreditation, laboratories accreditation, and certification bodies accreditation. So today we're going to talk about 6 practical steps to build resilient healthcare organization. These six steps, we're going to have the heads here of them. So the first one, I'm going to talk about leadership commitment. And leadership is a big word. So whoever we call them a leader means that they enjoy really high and advanced skills. So we're going to talk about this in details. So as the workforce, so when I'm describing someone as a leader, so which means I have to focus on the people here, the workforce that I have in my healthcare organization or in any other organization as well. Number 3, we have continuous learning, and it's a really deep topic that we're going to get into its details. Number 4, we have data-driven improvement. Of course, if I want to make any decision, I had to guarantee the results, and I had to see what's going to come, and I have to see evidence in order to avoid any risks and in order to avoid any potential mistakes or errors I could face. Number 5, the crisis preparedness. I have to be prepared for any challenge I can overcome. Number 6, continuous evaluation. And continuous learning and continuous evaluation, they are related to each other, and we're going to see how come. So we're talking about why resilience matters in healthcare. So let's go through resilience itself. What does it mean? Let's go to its simple words and its simple definitions. Resilience, in other words, it could be like flexibility. When I'm calling someone, he's a flexible person, which means that they are able to, first of all, face any challenge. They can have a fast reflex, they can respond, they can face, they can overcome, and they can recover from this challenge. They are just all in one. So when I'm describing someone as a resilient person, means that this person is a really flexible person and they can easily and smartly overcome a problem. So how about it matters in a healthcare organization? When I'm talking about healthcare organization, here I'm talking about patients' safety. I'm talking about people's lives, and we can know how highly important it is. So why specifically the healthcare sector? Because it's the sector that repeatedly faces constant challenges, such as the pandemic, and definitely we know how come. It's like the COVID that happened in 2022. So as the workforce shortages and financial pressures. So when I am in the front line in order to build resilience, in order to ensure care, patient safety, and organizational stability, I have to make sure that the resilience that I have is well built. And how can I do that? I have to go to something called capacity building. What is capacity building? Capacity building enables systems to adapt, recover, and sustain performance under pressure. So let's go to the capacity building actual definition. What is the definition of a capacity building? Capacity building is the process of developing and strengthening the skills, abilities, resources, and structures that organizations and individuals need to achieve their goals effectively. They can adapt to change, which is most important skill when we adapt to changes and we figure the problems, solutions out, and we ensure long-term sustainability. Okay, then let's go to step number 1. Strengthen leadership and organizational culture. So resilient healthcare starts with leadership. Why leadership? Because it does prioritize the safety of patients and the communication with the teamwork and also the patients as well, and learning. How so? The capacity building at the leadership level, it ensures that policies, decisions, and values, they all promote adaptability and accountability. So how can I apply that, and how can I strengthen the leadership among us inside the organization? We have to focus on a few steps that they can support this skill, our main skill. Let's say that we can establish leadership development programs, for example, that they are centered on crisis management and change communication. And we can also merge resilience principles into quality systems. Also, we can encourage open dialogues, trust, and learning from failure rather than punishment. Okay, just throw this all of it. Let's have an example, like supporting example for this. So let's say that there's a hospital that faced a sudden electronic record system outage, okay? And it caused delays and confusions, for example, in patient care. So let's assume that the leaders there, they have, or the decision makers, I'm going to call, they have reacted with blame instead of coordination with the team members. How is this going to affect us, and how is the results going to be, and the whole energy, how it's going to be? So if you want to figure a solution for this, let's go with the first step, which is leadership. The crisis management training, if we really apply them through our teamwork, it would enable the quick and organized responses. So as the culture that I just mentioned, it to promote trust and learning, and all of that would replace the blame and the negative energy towards the teamwork. And what matters the most, to be honest, not just in organizations and not just in work, it's the communication. It's a proper communication. Clear channels ensure updates, clear updates, follow up, and calmness among the staff and patients. So that's how it could be. That's how leadership can be summarized simply, and how it can be well applied in any organization, in any successful organization. Step number 2, we would build workforce capability and system competence. And how can we do that? The workforce capacity, it's among the people that they work, and it can be by a resilient healthcare system that depend on skilled, confident, and motivated teams. And especially here, let's focus on motivated teams. Motivation, to be honest, it matters the most in everyday's decision that we can make. It's an everyday that we can face it. Motivation would make me motivated always to stay healthy, to make the proper decisions, to go to the gym, to do the healthy and the proper actions in my life. So how about if I am a person who works in a healthcare organization and I'm motivated to provide more, I'm motivated to do the right thing, I'm motivated and I'm confident to make the right decisions, and I am skilled enough to do that. How can I do that? And how, if I own a organizational, a professional and healthcare organization, how can I do that? It is by creating opportunities for my employees by continuous professional development programs that they ensure that every team member contributes to maintaining care quality during any crisis or operational shifts. And here comes the capacity building focus. How can I do that through my capacity building? First of all, as I said before, the programs, the trainings, let's throw one training every 3 months. We will have 4 trainings by the end of the year, which really would make a difference in the experience and in my team's work. So we can develop ongoing training and certification programs linked to accreditation standards, the international one, definitely, like ISO 15189 and ISO 17025. Number 2, which I really, really like and support, which is cross-train staff to handle multiple roles during emergencies. So let's give it an example for this. If I own a laboratory, okay, and I have a lab technician who had a sick leave, for example, for a week, and this lab technician had to deliver few tests by the end of the week, but he's absent. So what I'm gonna do, it would cause me delay. It would cause people's and patients' anger, like, okay, my results should be here. And a lot of people, they have really, really high commitments that I need to report today because they have to do a lot of things in the very next day. So how can I just fill this gap that it's highly expected to happen? It is when I give a proper a training to the junior staff, for example, or the nurses there, where they can meet these needs and they can fill these gaps with some reasonable task. I'm not saying that they can take the whole job. I'm saying that they can do just reasonable tasks, that it can be done by people who are already in the same department. That's it. Let's move to step number 3. The continuous learning and system evaluation. Resilience is sustained through learning. Has never been luck. When I'm saying that it's sustained through learning, it's because I'm saying because resilience, flexibility, leadership, continuous learning, these things, they never happen in a day and a night. It takes ages. It could take me a few years to fix or to make a better how can we say it, a better performance that it can be done by our staff, especially towards the patient's safety. Okay, number 2, we have healthcare organizations that constantly evaluate performance and they can adapt to processes and they share the lessons learned. They are all are able to build internal capacity that lasts. And please highlight the word last here. So when I'm talking about the capacity building focus, how can I integrate capacity to the continuous learning and system evaluation? We can implement internal audit and quality improvement, of course. We can collect and analyze data to track progresses and identify weaknesses and apply corrective actions. So if I had a specific challenge and I made my analysis and I focused on it and I figured it out and I applied the suggested and the proposed solution. But through this whole process, I have made some errors. Let's not call it mistakes. We can call it lessons learned. And we're going to go through that just in the next slide. Also, encourage knowledge sharing across departments and partner organizations. So, in concluding, building resilience is not an isolated project. It's a capacity building journey. It's a really big word. As I said, it can take ages. It doesn't happen in 24 hours. So when leadership alignment, workforce competence, and continuous learning, they all come together, the first 3 steps that I just talked about, the healthcare organization here will not only survive challenges, they will also grow through them. So step number 4, data-driven improvement, turning data into decisions. So as I just said, if I want to make any decision in my life, I would like to see what people have done and what have happened to the people who had take the same decision. I want to see the results. I want to see evidence, and I want to make sure that everything is clear. I want to make sure everything is safe in order to be applied. In order to what? In order to avoid any risk that I could face and to avoid any errors that can cause me or cause any patient in my organization any harm. So we can use evidence-based insights to identify gaps in quality, safety, and efficiency. And we can implement real-time dashboards to monitor performance metrics, infection control, patient outcomes, and operational KPIs. And we can do it by encouraging culture of transparency, of course, where data informs, and align data with accreditation standards for measurable improvement. Okay, this is really good. The crisis preparedness. When I am well prepared to face any challenge, I am prepared to face any problem, especially when I know well what I'm doing and in which department I major in, so I could expect what I am going to go through. So it's the foundation of resilience. It's the base step and it's the base thing in resilience. We can establish emergency response plans covering pandemics, cyber threats, and natural disasters. That's really, really, really smart to be able to do that. And that will cause you a lot of competitors, by the way, and would put you by the best name in the market. So as we train our teams through simulations and scenario-based drills, definitely. Maintain essential supply chains and communication networks. Yes, of course. And we can link preparedness protocols to risk management requirements outlined in accreditation frameworks. Okay, our last step here, continuous evaluation. So I just mentioned in the second step, which is continuous learning. So I always say science is limitless. It's never end. It's endless also. So as long as we are able to learn every day, to get new information every day, So imagine in healthcare, imagine in medicine, imagine if I'm a dentist and I'm not really aware of the last tools that they are used to make the patient feel more safe or feel less pain or all of these things. Trust me, no one will gonna come to me if I don't know all of that. So when I'm saying continuous evaluation means everything I do, I have to keep myself in the safe side and I don't feel confident enough and I'm enough. I had enough I have put enough money in this. No, I have to not make sure that I do internal audits. I do have feedbacks. I do consider the outcomes of everything. So we can conduct regular internal audits and we can use patient and staff feedback to shape service improvement plans because definitely they will highlight something that I missed and everyone who is inside would miss, but people from the outside they will notice. And they, to be honest, they always told that us in the school. If I'm writing an essay, they always tell you, well, leave an or let another eye would evaluate your essay, which means I will never recognize I know the mistakes or the punctuation errors that I made, unless if there's other one who never was included in any other process I had, and they will tell you, yes, this and that, fix that and work on that. And we have to consider these opinions because they would really matter. So imagine if they are from people who already saw our service and they have dealt with us in person. So we can have the benchmark outcomes against international accreditation standards, and we can foster a learning culture. Every evaluation should lead to innovation, not to blame. That's how a healthy environment can be spread in the organization. So accreditation, the enabler of resilience. So we said, what is the foundation of the resilience? And here what I'm talking about, the accreditation, how it can enable the resilience happening. Accreditation merges best practices into daily operation, and it promotes teamwork, accountability, and risk management. And it also shifts organization from reactive to proactive. So pretty much it. That's us for today. Please, if you want to contact us, you have our telephone number, you have our email, and I will leave it right now for you in the chat. You can check our website, www.aaa-accreditation.org. All right. Thank you so much for your attendance today. I wish you a really, really lovely day. And stay tuned for our next webinars. And thank you. Thank you so much. See you in our next seminar. Bye bye.